Namaskar and a very warm welcome to this special program for India Science, where we engage with science and students to bring science to the masses. Let's talk health question hour. I'm Nidhi Kumar and you're watching India Science. I extend a very warm welcome to all our viewers and hope to answer your queries on mental health and COVID, especially for children. Well, after India overcame the third wave of the pandemic, powered by the Omicron variant of COVID-19, the number of infections is again going up in multiple parts of the country. And one of the biggest concerns has been the spread of COVID-19 among children. With schools reopening, cities including Delhi and neighboring Noida have reported a significant number of COVID-19 cases, especially among children and school students. Symptoms in children that parents should monitor amid the rise of the XC variant and the recent rise in cases in the backdrop of the XC subvariant emerging has prompted groups of parents to ask for physical classes also to be put on hold. In this program, we take your questions from Facebook and YouTube Live. And today we are joined by the very well-known Dr. Yatan Balhara, Additional Professor Psychiatry, AIIMS. Many thanks for joining us, Dr. Yatan. Thank you. My first question to you would be to tell our viewers today, what is mental health?
There are different ways to understand and define mental health. One of the ways is to draw a parallel with physical health, probably because we understand it better. So our body has different systems, and if these systems are performing at their optimum level, we are able to carry out our responsibilities. Our body is functioning in a healthy manner, and that's what a physical health looks like. Similarly, our mind or our brain also has certain functions. Functions like the way we think, the way we feel, the way we perceive things around us, and then even the way we behave. So when every of these functions are at their optimum level, we can say that a person is mentally healthy. Also, we must keep in mind that this overall concept of health includes physical health, mental health, and now people are going beyond that to the spiritual health, social health, and even economic health. So put simply, it's a state of overall well-being, not just absence of a disease or a disability, but when a person performs at their optimum best level.
Right, doctor. How would you quantify and tell us a little bit about if a child is sick with MIS-C syndrome? What is it in simple terms?
So these are a cluster of symptoms. A syndrome is basically a cluster of signs and symptoms. When a person has a particular disease, they experience these signs and symptoms. But I must mention at this point is that any syndrome which has certain specific signs and symptoms, the same set of signs and symptoms can be seen in different syndromes. So that draws to me this common concern that's going around among parents these days, as you mentioned very rightly, that if our kids are having certain symptoms like cough or running nose, or they're running fever, or they're not feeling well, is it coronavirus infection? I must say that yes, there is a possibility because that virus can have these symptoms as one of the presenting signs. But again, these can be seen in different disorders. Something as simple as common flu can also have these symptoms. So yes, that particular syndrome can be presented in terms of these signs and symptoms, but it can also be there in so many other disorders. So even today, only the test remains the gold standard to decide and to know whether your child or whether you have COVID-19 infection.
Yes, doctor. And some more symptoms, and is there any cause for panic for symptoms like, you mentioned a few of them, I'll mention some more, bloodshot eyes, diarrhea, dizziness or lightheadedness, or signs of low blood pressure, skin rash, vomiting you had mentioned. These symptoms, if seen in children, what should one do?
Presence of these symptoms is an indicator that the health is not at its optimum level. So they should not be there in the first place. So that's an indication that yes, you need a consultation. A consultation can be to a family physician, a pediatrician, or an expert, depending on the severity of these symptoms. But again, I'll start from where I left earlier. These symptoms can be seen in multiple diseases and disorders. So simply because your child has these symptoms, we cannot assume that it is COVID-19. you need to get tested, you need to get investigated. But again, I would mention that these are clinically significant. If you observe these in your children, you must consult a physician or a pediatrician. That's the way to start about it.
Yes, doctor, but sometimes because of the heat and this terrible heat wave that is going on, I think vomiting and dizziness in the head and heaviness of any kind could possibly be related to heat as well.
Yeah, dehydration is one of the possibilities, especially given the extreme temperatures we are witnessing and the ongoing heat wave. So that's a possibility. But again, you have to see the picture in totality. Is there a history of contact with somebody who had similar symptoms? How long the symptoms have been? How is the activity level of the child per se? And there are so many other bodily symptoms and systems that we need to explore, whether they are functioning well or not. So as I mentioned earlier, we need to look at the total picture, and then if there is an indication for a particular test or more tests, we should go for those investigations and then arrive at a conclusion. What is the possible diagnosis? It could be as simple as dehydration. Given the situation, the kind of weathers we are experiencing, especially in the northern part of our country, that's a likely possibility. So please don't panic. If your child has these symptoms, it's just a matter of looking for the right kind of help, not about panicking.
Yes, doctor. We have a YouTube question from Bhavani Mahendran. She's SGT Science, Chinmaya Vidyalaya, Senior Secondary School, Virugambakan, Chennai. And she wants to know, students wear the mask the whole day. This is a matter of worry for parents, teachers and students, as we have 35 to 40 sitting in a class. Will changing mask 2 to 3 times a day be helpful to prevent other respiratory problems, or should they, what should they do? Carry 3 masks?
See, wearing a mask is still one of the recommended strategies against prevention of spread of coronavirus infection. So I would strongly advise that if the public health agencies and if the local governments, they are advising for using a mask, please use it. That concern is valid, because if you are wearing a mask all through the day, there are chances that if your mask is not clean or if it is infected with some other pathogens, you might acquire certain problems. So the point is, wear a clean mask. Wear a mask that is recommended by the health authorities and change it regularly. It should not be seen as a burden, because the kind of benefit we are getting by using a simple thing like a mask is far more than the inconvenience that we are having. And we must remember, the pandemic is not over yet. It's still there with us. So we should not let our guard down, and mask is one of the effective ways to prevent it. So I would respond by saying that yes, ensure that your mask is clean. If not every few hours, at least change the mask every day. There are certain masks which can be reused, they can be cleaned,
washed,
cleaned, and it can be reused. So find a mask that suits you, but do use it.
And Mask Up India. Tell us about the vaccination of children and XE variant, sir.
So that's another common concern among parents these days. What I would mention is that there are different kind of vaccines available now, because our understanding into illness is much more better, and there are different companies that have come up with different vaccines. Now these vaccines, they have been tested in different age groups. To begin with, usually medicines are tested in adults, and then as we have more information on these vaccines, we move towards other age groups, especially adolescents and then younger children. So as of today, there are certain vaccines which have been approved for use among adolescents as well. Even Government of India has now allowed use of certain medications to adolescents, some of these vaccines, and they are available free of cost. There are other vaccines which have been tried in even younger populations, as low as 5 years. So depending on the kind of vaccine that has been approved for a particular age group, it is recommended. And if there is a recommendation for its use, then the parents can go ahead and get their children or adolescents vaccinated if they are eligible for that.
The Government of India has just come up with a new vaccine order for children between 2 and 12 years. What is your take on that?
So that is a reflection that now we are having a better understanding in these vaccines. Our knowledge has improved. We are more confident that these are effective and these are safe. And as I mentioned earlier, the more data that we get, more comfortable the scientific community is in recommending these medicines to younger people. So if the recommendation is there, please go ahead and get vaccinated.
Doctor, please tell us what is anxiety disorder and how can it be treated?
So anxiety
And how many kinds of anxieties are there?
Okay, so anxiety disorder is one of the commonest mental health issue that people suffer across all age groups, so to say. So this is a condition where the predominant symptom is a feeling of restlessness or uneasiness, or a thought that goes in your mind that you are not at ease or at peace. It might have certain physical symptoms like trembling of hands. You might have palpitation, that you can feel your heart running. The pulse rate can go up, your blood pressure can go up, you may have sweating. And then there can be certain behavioral symptoms. For example, you are restless, you are not able to sit quietly at a place, you may be fidgety. And of course, there are cognitive symptoms that your mind knows it's always running, it's always thinking about something. So those are the kind of symptoms that people experience when they have an anxiety disorder. Now, anxiety disorder can be of different types, as you very rightly asked for it. There are different kind of disorders depending on the nature of symptoms, the way these symptoms emerge, and for the duration for which they stay. So there can be disorders like panic attacks, where anxiety is very severe but short lasting. Then there are phobias, for example, social phobia, where people have fear of being in presence of others who are not familiar to them. And finally, there can be a more generalized kind of anxiety, where a person is anxious almost all through the day in all situations. That is called generalized anxiety disorder. There are others as well, but these three are the most common that we see.
Since we are talking of children, do you think anxiety disorders is prevalent amongst them?
Yes. Even among children, it's one of the most common mental health issue that we encounter. And as I mentioned, there are three main types. When it comes to children, there are certain other kind of anxiety disorders. For example, there are some children who they refuse to speak in certain situations, and that can be out of anxiety. Parents would have noticed that at times their children, they refuse to go to school or unfamiliar places. They can also be arising out of underlying anxiety. Similarly, different kind of phobias, fear of certain places. Exams or certain animals, that can also be a manifestation of anxiety disorder. So yes, even children experience anxiety. It can be a phasic anxiety, like you mentioned, during their exams, or it can be something that lasts and persists almost all through the year when the diagnosis is something else.
Yes, doctor. We have another YouTube question as we speak. Bhavna Dikshit, PRT Science, Bhavans Vidyalaya, Panchkula, Haryana. And she wishes to know, as coronavirus continues to mutate, how effective will be the current vaccines against the new variants?
So, I mean, the way you are concerned, this particular viewer of ours, there is scientific community who are kind of working on this particular question day in, day out. So whenever there is a new variant, the vaccine manufacturers, they go through the whole process of testing it for that particular variant, and the results get published in due course. So all the variants that we have had till now, different vaccines have been tested for most of them, and it has been found to be effective to different extent, and that is understandable. So any new variant that comes up, and there are people who are going to test the vaccines against these variants as well, and the results will be available. So we need not worry. There are people who are much more qualified and who are already prepared to engage in that kind of research, and that result is available with time. Also, that kind of information goes into kind of redesigning these vaccines. As the pandemic goes, as new variants come up, there might be new strains of these viruses that might be included in these vaccines. So that's a process that science always takes. That's the path it takes, and we need not worry about that bit, I believe.
Yes, doctor. My next question to you is that during the pandemic, there have been multiple cases of behavioral and emotional disorders. So could you tell us a little more about this, especially for children?
Yeah, so that
What is behavioral disorder and what is emotional disorder?
Yeah, so it kind of takes us back to the beginning of this episode where we started with what is health. So as I mentioned there, health is a complex paradigm. It includes our thoughts, our emotions, our feelings, and our body. So some of the ways our body and our mind tell us that it's not healthy is by manifesting through behaviors. These behaviors can be somebody getting irritable, someone throwing temper tantrums, someone refusing to speak, someone withdrawing within himself or herself, and on other extreme, people being too vocal, talking too much, and even irrelevantly at times. So there is a complex set of disorders which can appear where the main manifestation is a problem with the behavior. Certain disorders like ADHD, conduct disorder, oppositional defiance disorder are some of the examples that we see in children and adolescents. So when a child is experiencing certain kind of stress, they can experience anxiety, they can experience depression, but at times they can experience what is called as externalizing disorders, which are ADHD and conduct disorder. So these are from the broader set of mental health conditions where the main manifestations are changes in behavior which are abnormal.
Yes, doctor. We have a YouTube question now from Neha Bharadwaj Sharma. She's a TGT Science at the Government Senior Secondary School, Bhupani, from Faridabad, Haryana. And she has a very relevant question. She says nowadays students are getting high fever, high grade fever for a day, and then symptoms like dehydration and diarrhea, and they do not even get tested. With our repeated requests going out to parents for testing, still, you know, a lot of students come to school without going through the test, and within 3-4 days of them having faced these kind of symptoms. So will social distancing help in such cases when the government also says 100% attendance?
Yeah. So see, physical distancing is a strategy that works. Now, how effective it will be, it depends on how diligently and with what fidelity we follow it. So for example, in this case, when we know that a particular person is having certain symptoms which can be indicative of coronavirus infection and they're not taking due precautions, then they are putting themselves at risk and those around them at risk. So in this situation, physical distancing might not be as effective. But that doesn't mean that if we are not following one particular recommendation, we should stop following the others as well. So if the child is there, the others around the child should ensure that they are wearing a mask, they are maintaining a distance, and they are following hand hygiene. Because those are the only ways to reduce the risk of transmission. And people who are experiencing the symptoms, they have a responsibility to themselves and those around them, both at school as well as at home, that they should ensure that they get detected in time so that they can be benefited and those around them can also get benefited in the process.
Doctor, can you please explain schizophrenia with examples? What is it and how do you qualify that?
So schizophrenia is one of the psychiatric disorders. It's part of a broader group of disorders called psychotic disorders, where the main symptoms are that a person is out of touch with reality. Your judgment may be impaired and you don't have an insight into your situation or your condition. You might experiencing certain symptoms like delusions and hallucinations. There can be other presentations where a person is having what we call as negative symptoms. There is a reduction in speech output, a reduced interest in day-to-day activities and pleasures. There might be lack of motivation and will to engage in meaningful activities. Some individuals with psychotic disorders and schizophrenia can have more disorganized speech and disorganized behavior as well. So it's a heterogeneous set of conditions where people experience the psychotic symptoms. It's not a very common mental disorder, but yes, those who experience it and the caregivers around them, it can be a very disabling and a very distressing condition to experience.
And how do you kind of treat this kind of disorder? What are the medicines or what is the line of treatment protocol?
So the basic approach for any psychiatric patient is we begin with a systematic assessment and evaluation, which reaches to a diagnosis, and we know that what we are treating. The management involves a few investigations just to see how the bodily systems are working, because in case we are using certain medicines, we need to know the baseline functioning of different bodily symptoms. There can be medicines that we can use. Then there are certain approaches that are called as non-pharmacological approaches or the psychotherapies. And the most common approach is to use a combination of both medicines and these non-pharmacological interventions. Depending on the stage of illness, whether we are talking about an acute phase or a chronic phase, the choice of medicine, the dosing, and the choice of non-pharmacological therapy, it changes. Usually treatment takes a few months and a couple of years. And even when a person is asymptomatic, they should not discontinue treatment abruptly because it can increase the chances of relapse. So what we advise is, even when you are asymptomatic, follow with your psychiatrist, follow with your clinical psychologist, and do as they advise. Absence of symptoms might not mean that the disease is also not there.
Yes, doctor. Very well said and explained. I would like to now understand from you, what is bipolar affective disorder? What does it mean?
So bipolar affective disorder, the affective disorder means it is a disorder of our mood. Mood means the way we think. Yeah, we feel the way we feel, actually, not the way we think. We can feel happy, we can feel sad, we can feel anxious, we can feel scared or frightened at times. So the word bipolar there means it is an illness with two poles to it. One of the poles is the lower pole, that is called as depression, and the other pole is the higher pole, that is called mania or hypomania. So when a person has a combination of these two poles, that is depressive episodes along with manic or hypomanic episodes, it's called a bipolar affective disorder. In some individuals, they might have only hypomanic or manic episodes. There might not be any depressive episodes. In those cases also, we use the diagnosis of bipolar affective disorder. It's again a mood disorder, can be very disruptive, can be very distressing, and lead to a lot of dysfunction. Effective interventions are available for it as well, but the treatment, it has to be continued as per the advice of your treating physician and psychiatrist.
We have another YouTube question, doctor, and I'm clubbing this because it's from the same school. One is from a student and one is from a teacher. Yukti Shingal, class 8th, and Miss Bindu Muralidharan, TGT Science from Cambridge School, Noida. And they want to know, do we really have to be scared of COVID, or are there any chances of any other wave coming in India which is more dangerous for children from 5 to 15 age group, and these children have not been vaccinated yet, or the vaccination has not been discovered, but it has been discovered, which is what the doctor said earlier. Maybe you'd like to clarify the rest.
So exactly, you put it very well. Predicting the next wave is very difficult, and at least I am not in any position to predict when the next wave will come or whether it will come or not. But what we know as of today is that we are much better prepared than what we were around 2.5 years back. We have a lot more understanding into the disease. We know much better about the COVID. We know much more about the treatment, and now there are many effective vaccines also available. And as you very rightly said, there are vaccines that have been recommended for children as well as we are speaking. So I would say that we are much better prepared than what we were. Even if there is a next wave that's on its way, I think we must put to practice what we have learned so far, and that includes COVID appropriate behavior, use of vaccination if you are eligible, and testing to get detected, and starting the treatment as soon as you need it.
Because the waves will keep coming, as most people in WHO have been saying. COVID has not gone anywhere, so we need to be taking all the right precautions and masking up and testing, as doctor said. My next question to you, doctor, is what is neuromodulation in mental health practice, and what is its role?
Okay, neuromodulation is a term that is used for a set of techniques where you use certain interventions to alter the way our brain and our mind is functioning. These are non-invasive techniques, so to say, where you use certain therapeutic equipment to modify or to improve the dysfunctional bits of our brain and mind. There are techniques such as RTMS that is available in our country. I would say that these techniques have been tested in research around the world, but the evidence is still coming up for many disorders. Yes, they have been found to be effective in certain mental health conditions and disorders, and these are available in our country in different hospitals.
Right, doctor. So if a relative of XYZ person has a manic or depressive symptom, then would you prescribe a thyroid screening for that as well? If so, what could be the result? What kind of screening is done for
So people who have undetected hypothyroidism, the research has shown that their chances of having mood symptoms, it goes up. Also, in certain age groups and in certain populations in specific genders, the risk of persons having comorbid hypothyroidism is higher if they are presenting with depressive symptoms. So based on the indication, we do get thyroid function tested, and there are certain populations where we always get it tested as a rule as well. So yes, it has a place in diagnostic investigations, diagnosis and investigations in psychiatric disorders like depressive illness, but then we just cannot use it randomly. There are specific indications for it, and in case we get it tested and there is a problem with the thyroid function, we need to make that diagnosis, what that thyroid problem is, and the appropriate treatment has to be started for that.
Doctor, there are several other problems that people face in mental health, not just children, I'm talking of adults. Could you spread some light on paranoia and dementia, and what exactly is the difference between the two, sir?
So, paranoia is a state, a mental state, where a person feels kind of suspicious of the environment and the world around them. It might also come from the anxiety within, that you yourself are not comfortable or confident of intentions of people around you. So that's a state of being where you are kind of feeling suspicious. You may be having extreme anxiety. You might not be comfortable being around with people because you suspect them for their intentions. So it's that kind of a state that you are in. Dementia, on the other hand, is a neuropsychiatric disorder that is typically seen in people who are aged 60 or more. There are different causes of dementia, but one of the defining features is that there is global decline in cognitive functions. So your memory can go down, your attention concentration, it reduces. You might not be able to recall and recollect things that you remembered from your past. It might even lead to impaired judgment and poor insight at times. So it's a neuropsychiatric disorder which is commonly seen in elderly population.
Right, doctor. And are there any kind of specific cures for these mental health problems which we see or which we've spoken about? If so, what are they?
So there are effective treatments available. There are medicines that are there which can improve the symptoms. There are medicines which can slow the progression of disease, and there are medicines which can improve the quality of life that a person has. Similarly, there can be non-medicine based interventions, psychosocial interventions, which can again improve the symptoms. They can improve the functioning of a person, and they can improve their quality of life. In terms of cure, most of these disorders, they cannot be cured in the sense that there are no treatment available which can declare a person cured of it. But I must mention the kind of treatments that we have as of today, they are very effective. If used as recommended by a trained mental health professional, they take care of the symptoms very well. A person becomes functional. The deficits, they are to the minimum or even absent in many cases, and one can lead a reasonably good life, free of symptoms, free of dysfunction, if you follow the recommendations well.
Absolutely. So in the end, I'd only like to say that we need to be very alert, and especially to all the parents watching this program, I'd like to thank you for watching, and I'll request you to be alert. And on that note, I'd like to thank you, Dr. Yatan Balhara, for joining us today, for sparing your valuable time and educating us here at India Science. And with this, friends, this is a wrap on this edition. We'll be back with more interesting episodes on Question Hour. Till then, get vaccinated. That's the only way out. Stay safe and keep up the mask. Mask up, India. On that note, namaskar. Many thanks for watching.